Place your other hand on top of the first.
Alberta Health Services Emergency Medical Services has developed a provincial registry of automated external defibrillators, or AEDs. The goal is to allow 911 dispatchers to guide callers to the nearest AED device during a cardiac emergency and to ensure that the devices are maintained and ready to use.
Alberta Health Services is delighted to be introducing a provincial-wide public access to defibrillation program where we've developed an online registration and tracking system so that we can monitor where exactly AEDs are throughout the province. AEDs, automated external defibrillators, that are used for trying to stop a cardiac arrest and put a heart back into a normal sinus rhythm.
Calgarian John Lester had just come off the ice during an early morning hockey game in March when he slumped over.
I was playing in a hockey tournament at the Thorncliffe Greenview Arena. My heart went into defibrillation. At that point in time, one of the guys in my hockey team administered CPR, and the arena facility attendant knew where the AED was, knew how it worked, and immediately brought it over to the bench where they were working on me. If it hadn't been for that AED, I probably wouldn't be here talking to you guys today.
The simplicity of the machine is as it's laid out here. Follow the numbers. Step number 1, turn it on. Step number 2, listen to the machine and apply the pads to it. And step number 3, which will be pressing for the electrode or the electrical shock that would be delivered to the patient.
My survival was based on people knowing what they were doing and the equipment working the way it was supposed to work. Thorncliffe Greenview did a pretty good job. They just had changed the paddles out, and the facility attendant had just taken a refresher course on use of the AED. So I'm a pretty lucky guy. All the stars were aligned for me to make it through this thing.
Some of the times we know that AEDs are out there, but they're not being maintained in a regular fashion, and it has the risk of a battery going expired and dying, or the pads expiring or not even there. So our enthusiasm is to encourage communities to register their device with us at heart-safe.ca. We can then track that device. We can send them out an email reminder that their battery is about to expire or the pads are about to expire. And we ask that they do a monthly maintenance check on the device. That way we can integrate that information into our 911 dispatch, and when somebody calls for emergency help, the dispatcher can facilitate where is the closest device to that patient and get them help a lot quicker.
The Public Access to Defibrillation program is one of the first of its kind in Canada and will increase access to the potentially life-saving devices in the critical minutes immediately following a cardiac arrest. The registry will be made available to AHS EMS dispatchers starting this summer, with the rollout expected to be complete by early 2013.